All right, we're in the last bit of muscular anatomy. We're going to now focus on the upper body. We did the lower body. We did a brief introduction to the core, acknowledging that it is more complicated than that, but we hit the major concepts. Now let's go ahead and hit the major muscles of the upper body, starting with the shoulder joint. Now, just a quick review. Remember, we looked at that shoulder complex and we looked at that scapulohumeral, also known as scapular-thoracic rhythm, right? And we said you've got all those 3 bones and 4 joints. Look at the little animation again, same animation from earlier, all working together. And why do they do that? It maintains that glenoid fossa, that in theory a socket, but once again it's more like a saucer, in an optimal position to receive the forces from the head of the humerus that increases the joint congruency, or how well it fits together, while decreasing shearing forces, rubbing forces. What does that mean? Basically all that means it has improved distribution of forces. That's what this movement is all about. If you throw off the movement of the scapulohumeral rhythm, if you're offbeat, if you will, if the rhythm is off because of maybe, once again, muscular imbalances up here, short, tight muscles on one side, short, tight muscles on one side, long and weak on the other, and you throw off that scapulohumeral rhythm, you're going to put, once again, undue forces on the joints. You're going to put strain on the joints, and once again, you won't have as good force output. So that's why it's important as we start looking at the anatomy, don't just look and try and memorize anatomy, start realizing, well, wait a minute, what happens if we're out of whack? If everything's not lined up appropriately, more likely for injury, less for, and we're not going to get as good output either. We're not going to have good force distribution. We're not going to meet our potential. So first and foremost, before we start training someone super heavy or super hard or anything, we got to make sure that they're structurally sound and everything is moving as it should. And if it's not moving as it should, we have to address it and get it moving as it should. And if it still doesn't work, then we have to refer out to a professional like a chiropractor, an MD, or a PT, a physical therapist. We refer out to professionals to get them moving right, and then you can train them properly. Otherwise, once again, they won't meet their full potential and they'll be much more prone to injury. Okay, lecture done. I'll get off my soapbox there now, and we'll move once again to shoulder anatomy. So let's look at the deepest shoulder anatomy here as far as muscular anatomy. Let's look at that good old-fashioned rotator cuff. I've got a great little picture here. I'm going to break it down into its 4 individual segments. Rotator cuff, we think rotator, think rotation. Well, it does that and more. So the first rotator cuff muscle lies on top. It's called the supraspinatus. Well, think about the name here. Names tell you a lot when it comes to muscles. Supra, meaning above, spinatus, the spine of the scapula. So it starts, there's a little ridge on the back of your shoulder blade. You can actually feel it. It lies right on top of that and inserts to the top of the humerus. So that muscle actually does more abduction out here, all right? Next, you have what's called the infraspinatus, all right? Infra, below spinatus, all right, and wraps around to the back of the humerus. That does external rotation. Then you have teres minor that actually lies below that and also does external rotation. And then you have the subscapularis, underside, under, sub, scapula. Okay, so if here's my shoulder blade, on the underside, the anterior surface of the scapula, it wraps around, that's my internal rotator. So yes, the rotator cuff does all those things. It does abduction, external rotation, and internal rotation. It does all of that. It does more than that. This is my own personal way of looking at it. It's not how books say it, so forgive me. This is the Scott way for a second. I look at it almost like a dynamic ligament. What do I mean by that? Ligaments do what? They connect bone to bone, right? Well, what the rotator cuff does, when it fires properly, it ensures that ball and saucer, all right, the humerus going into the glenoid fossa, not only is in there properly, but has proper arthrokinematics. Right? Remember we talked about that term earlier, that proper movement here. And it's really important that the rotator cuff does its job, because if it doesn't do its job properly and or it's overworked and damaged, not only will you get pain in there, but if it doesn't actually do its job for proper arthrokinematics, all of a sudden you could have things like shoulder impingement issues. You could have other bones actually hitting down on top of the bursa or the muscle and just ripping into it. It's the rotator cuff's job to make sure that there's dynamic stabilization and the proper movement within that actual shoulder joint. All right? Moving on now. What about other scapular motions? Just look at the scapula and back. Well, we know that there's elevation and there's also depression. There's also scapular abduction, all right, and scapular adduction, also known as protraction and retraction. And there's also what's called upward rotation and downward rotation. Let's just look at abduction adduction, also known as protraction, retraction. Your main scapular abductors or protractors, that is your serratus anterior and your pectoralis minor. So once again, think about muscles coming from here, attaching into the shoulder blade and pulling forward. Those are your protractors. Versus your scapular retractors or scapular adductors would be back here. That would be like your rhomboids. Once again, look at where the rhomboids are located. Look at the little picture. Pulling it, those would naturally pull those shoulder blades back. Also the middle part of your trapezius, the middle traps, and also your levator scaps all work in scapular retraction. Moving on now, what about, once again, elevation and depression? I already mentioned those earlier. So once again, elevators would be the ones on top here. That would be your upper traps. Once again, your levator scap, heck, see in the name levator, like elevation of the scapula, levator scaps, and your rhomboids, because of the angle of the fibers, also do some elevation. While depression would be more like the muscles pulling down, your pectoralis minor once again, and your lower traps. All right, now let's talk about shoulder flexion and extension. So once again, if we're talking in there, we're talking crossing this glenohumeral joint here in front would be your shoulder flexors, and pulling it back down posteriorly would be your extensors. So your major shoulder flexors would be your anterior deltoid, which makes sense right here. And from this position, your upper pec fibers, actually your pec, you're going to find out, starts up here in the clavicle and then goes out into the sternum here. There's actually two segments, one that starts in the clavicle, one that's in the sternum. The clavicular fibers here also cross that joint and also assist the anterior deltoid in shoulder flexion. And there's also a deeper muscle called the corticobrachialis. And once again, look at the little picture. It doesn't take a rocket scientist to say, okay, there's that little muscle. If I shorten that muscle, it's going to do this. Moving on once again, shoulder extensors. So now the muscle that does this when it's loaded, so it's like this pulling motion. So say I have a band or a rope or a cable here and pulling downward. All right, and why am I making that distinction? Because if I just do this with weight in my hand, gravity's pulling it into extension, right? So if I have to have a resistance pulling this way. So if I have a resistance pulling this way and I'm pulling against that resistance, the main shoulder extensor you have are your lats, your latissimus dorsi, the big fan-shaped muscle. It starts in that thoracolumbar fascia, okay, that same fascia that the transverse abdominis ties into. So it ties in from the bottom 6 thoracic vertebrae, all 5 lumbar vertebrae, and even into your pelvis. It's actually your only muscle that connects your upper extremity, your shoulder girdle, to your pelvic girdle, all right? And it wraps up and around. It's a big fan-shaped muscle, look at the picture, and attaches anteriorly into your shoulder joint. So what it does shoulder extension. It actually even does a little bit of internal rotation because of the way it's inserted. Now, once again, if my arm is up here and I'm pulling down, guess what? We usually think the pecs and the lats do opposite things. Pecs more of a pushing muscle and the lats more of a pulling muscle. That's true. But if I'm pulling something from up here and I'm pulling down, my lower sternal muscles of the pec can actually assist the lat. So when I do something like a pullover, it's a lat and lower pec exercise to some extent. And another shoulder extensor, once again, when it's loaded, is the teres major. Okay, and that inserts. It acts just like a smaller version of the lat, basically. So it assists the lat. Anytime the lat works pretty much, the teres major is going to work virtually every time. All right, so we did flexion and extension, and we also talked about the rotator cuff, about rotation a bit. What about adduction and abduction? So the major abductors, once again, if I'm doing this motion, I need muscles on this side of the joint to be doing the work. Well, I already said one, that was the supraspinatus, that was that rotator cuff on top. More major one on the outside, all right, would be that middle deltoid. Now, moving back down to adduction, once again, the same idea. It has to be loaded though, because right now I do adduction, and guess what? Gravity's pulling me that way, right? And the abductors are actually just slowing it down. I'm working eccentrically. But instead, if I were pulling something this way, once again, a rope, band, something pulling up this way, and I pull down into adduction, like a lat pull down or a pull up, well, that would be, once again, you can imagine, here's that lat muscle again, latissimus dorsi, would also work, all right? And same idea here, the lower pec muscles, all right, depending on the direction of pull, might assist as well. And once again, the teres major. So your same muscles that do extension at the shoulder will also assist in adduction of the shoulder. Okay, whew, we keep going now. We already mentioned the rotator cuff for internal and external rotation. I covered that. What about horizontal abduction and adduction? Now, we mentioned that as a special case earlier when we talked about kinesiology. So you have horizontal adduction this way. That would be your pectoralis major. Your anterior deltoid would help out virtually every time too. So those will always work together whenever you're doing a pressing motion out like this, as well as the corticobrachialis. Then you've got the horizontal abductors. Well, that would be mostly the posterior deltoid with a little bit of middle deltoid helping out, your infraspinatus and your teres minor. All those helping pull back this way. All right, so there's the shoulder. What about the elbow? Remember, we looked at the elbow complex before, right? You've got the hinge joint that is the elbow. You've got your humerus right here. You've got the radius on the thumb side, and you've got the ulna on the pinky side. And you've got that radial ulnar joint that does supination, pronation, and that's important. Why is that? You've got your elbow flexors. There are actually 3 primary elbow flexors. It's not just your biceps brachii, the one up here, okay? You also have your brachialis and your brachioradialis. And this is important distinction here. So you've got three muscles that cross the elbow joint right here. The brachialis connects into the ulna, while both the biceps brachii and the brachioradialis connect into the radius. Who cares, right? Well, this is where origin insertions are a little important. If I do elbow flexion this way, and I load it up here with my palm down, I'm pronated. What's happened is I've wrapped my radius. Remember, it crosses over like this. So my biceps are kind of wrapped, the insertions down and underneath. Well, why is that important? Well, by doing it this way, I'm not actually going to get a whole lot of biceps activation. It's not just because my biceps are weak right now and I don't have a lot of weight in my hand. They're not in a good position to actually do this motion of elbow flexion. This is the brachialis, all right? But as soon as I start going here, now when I'm thumb up like in a hammer curl position, now the brachioradialis is lined up to help out as well. So now I'm stronger because now I've got both the brachialis and the brachioradialis working. So brachialis is always going to work because it connects in the ulna. Then when I go into the biceps, you can actually see the biceps shorten a little bit. Biceps actually act somewhat as a supinator as well as an elbow flexor. All right, so you've got the biceps turning on now, and now I've got the biceps, a little brachioradialis, and still a lot of brachialis. In fact, brachialis is probably, you can even say, more of your primary elbow flexor. It's not your biceps, it's your brachialis. It's just biceps is the one that we see in the mirror, right? So if we want to work our biceps for aesthetics, we want to go palm up. If we want to work more of our brachioradialis and emphasize that, all right, we'll go thumb up, and brachialis is going to work in whatever position you're in. So that's, once again, kind of the idea of knowing the position of the hand is going to make a big difference which elbow flexor you're going to emphasize. All right, moving on a little bit, let's talk about the elbow extensors. You've got your triceps brachii in back. Once again, triceps 3 heads. I should mention it, biceps 2 heads, bicep 2, right? Triceps 3 heads, right? And the triceps cross the elbow joint. Long head also crosses the shoulder joint. And all 3 do elbow extension. And you have another one, another tiny little muscle underneath called the anconeus. I think I'm pronouncing that right. Forgive me, anyone who knows better, or anconeus. I've heard it both ways. I don't know which one's right. But that's also another elbow extensor, right? But notice something. The triceps actually insert into the ulna. So if you're doing a tricep-specific exercise, like a tricep pushdown, okay, no matter what hand position you're in, it's not going to hit the long head versus the short head versus, it's not going to hit a different head differently. It'll feel differently. It's a different exercise. It's a different motor pattern. It'll change the leverage just slightly because of the position in your hand, but it's not going to hit a different part of your tricep differently. It doesn't work that way. All right, so that's gym myth right there. It's good to work multiple hand positions. I'm all for that. Just realize that you're not necessarily going to emphasize one head of the tricep versus another, depending on hand position. Just like you're not going to actually work a different head of the bicep this way, depending on hand position. However, you could basically virtually turn the bicep off. Basically, not completely, but you make it so it doesn't work very well when you're pronated. So hand position means a lot when you're working your elbow flexors, specifically your biceps brachii, but doesn't mean as much when you're working your triceps. Now, I already mentioned we've got your biceps brachii, which is one of your major supinators. once again, there's lots of muscles down here. Just like the ankle foot I mentioned, there's lots of muscles going to the ankle foot that control the foot. There's a lot coming here, obviously, to control the fingers and the hand. We're not going there. We're just going to talk about elbow and a little bit of those supinator muscles, right? Well, we always said the biceps brachii is a major supinator. There's actually another one that's very important, and we'll show you the picture of it right here. Hold on to your hats. The name of this muscle is supinator. All right, once again, it's not rocket science. So you've got the supinator, and then you have several pronating muscles as well, such as like the pronator quadratus. You have lots of those. But rather than just purely memorizing, just kind of see where those muscles are at and kind of get an idea of why they do the job that they do.